The doctor is an expert in healthcare, how to take a history, how to examine, how to come up with a differential diagnosis, how to come up with a plan of action. He's also an expert in terms of knowing what the local services are like, the local hospital, the local physio and so on. But the patient is an expert too. She's an expert in her symptoms, she's an expert in terms of how it's affecting her family, her work and everything else. And of course we've got a third expert in that room, which is the computer system. I might not know her from Adam or Eve, but when I put her name into the computer system, up comes her record showing me what she suffers with, what medication she's on, what previous consultations I've had, letters, test results and so on. And the really exciting thing is when we turn that screen around and allow the patient to see the same information as what we've got, then amazing things happen. So that's what we're doing. That's the magical moment when a clinician says to the patient, right inside the consulting room, I recommend that you should access your records. We've been doing this for 8 years. When I first started, I was absolutely convinced that within 6 months I was going to get referred to the GMC because of breaking confidentiality. It hasn't happened. I never thought 8 years down the line I'd be standing here and I'm still waiting for my first problem. But that's because I was incredibly pedantic about making damn certain as a data controller that that patient can handle their personal information in their own time. Not only that, but we're now moving beyond just accessing viewing records, and some of us in the room are already recognised, oh, we don't want patients just looking at the records, let's start co-producing the record. Let's start moving towards patients adding to the record itself. So we've introduced instant medical history. Instant medical history, these questions that get asked, it converts it into a medical history that is much more understandable by clinicians. And we did a piece of work that allows that to be dropped straight into the EMIS web clinical system, so that as a clinician I'm not going to another website putting passwords in, it's right in there. I think this is the future. It's not just about viewing your records, but it's now starting to co-produce. And the point about this is that there are standard questions that can be asked by the system. It doesn't tell us a diagnosis, but it allows the standard questions to be asked so that we can then go into more depth either around explanation or perhaps things that are very specific in terms of the family auto. How many people in our practice are doing it? Well, these are my latest figures from a couple of days ago, and we've now got 3,245 patients. You can see age groups from the bottom, from 0 right through to 90 plus. Those of you that follow me on Twitter will know we've now got a 100-year-old patient who's accessing her records. Let's look at it slightly differently in terms of conditions. 33% of our patients with asthma are doing what Ingrid is doing. 50% of our patients with depression and anxiety are doing this. This is parity of esteem stuff. These are patients who've got a long-term condition, who've now got a psychological problem, and they are managing their psychological problem by being able to see what's going on, by being able to see what their doctor or nurse has written. Interestingly, medications online ordered, only 6% are doing it. So this idea that everyone's going to first of all order prescriptions online and then they forget it, the evidence doesn't show that. Patients want to be able to see the records and they might think about ordering prescriptions online. It goes back to caring and compassion. That's the most important. That's why we come into healthcare for. We want to deliver care and compassion, and this is what this does. We want to create time for those people who really do want to see us, but similarly, those who've got better things to be doing, rather than sitting around waiting for a doctor to tell them their test results are fine, let's create time for you, so that you can get on and do what you're doing rather than be stuck in GP surgeries and the like. It is about improving health literacy. That's the holy grail. That's what we've got to do. We've got to improve the level of understanding of the community so that people can self-care more. We've got to start thinking about journeying with patients and building this partnership that was always there, the doctor-patient relationship. That's not going away. The digital doesn't take that away. In fact, it strengthens it if we start thinking like this. And we've got to start thinking not about delivering to everybody, but safety netting for those that really do need to see us. And thinking not just about activating the individual. That whole thing about confidentiality and privacy has freaked us out so much that we can't say anything to anybody else. And we've got to start thinking about activating the family, because believe you me, that's exactly what I'm doing inside our practice. We're talking to the mothers who are then getting their husbands, their children, and their parents signed up. That's about activating families and thinking about how we do it. I know this is not going to happen. I know the extreme lengths that we are having to go through at this moment in time in our own to do this. This is not going to scale unless we find the funding to make this happen and make this important. What are we going to stop doing? Because all of us are running like mad, so we've got to stop something. We've got to start to look at the things that are not delivering, and there's a whole load of policies that are about to hit us. We've got to turn around and say, who's going to stop that ship? Who's going to turn around and say, we don't want you to do this because this is more important? That's a challenge for all of us. The practices want to do this. There are individual practices services are saying, no way, Jose. But there's the opportunity that we've got. If we can multiply this, if we can make this happen within our CCG, then we open it up and say, right, now we are ready to make this fly. Who wants to come and see what we're doing? This is how we're doing it. This is how we're reaching out to the world. Thank you very much.